Hi, everyone. This is Swati Goyal, one of the program associates here on the DASH team. I am going to pull up Mentimeter right now, and so you'll see the link to the website that says www.menti.com, and then the code is 360265. So if you guys can go ahead and get that started, you'll see the answers pop up as you fill them in. Thank you.
Do you want me to take that in?
Good afternoon, everybody. We're going to start right on time at the top of the hour. For those of you who are logged in but not looking at the screen, we do have a survey up. We'd love it if you could take it. You go to menti.com and then enter the 6-digit code at the top of the current screen. We're going to do that at the start of the meeting, but you can go ahead and get started on it. There are 7 questions. Thank you.
Oh, something else.
Good afternoon, folks. We're going to get started in a couple of minutes as you join the call. We'd love it if you could use one of your other browsing tabs. Go to menti.com and take our 7-question survey. It's helpful for us to understand who's on the call. And so menti.com, use the code, and I promise we won't say anything important before we go through those answers. Thanks. Good afternoon, folks. My name is Peter Eckert. I'm one of the co-directors for Data Across Sectors for Health, and welcome to our webinar today about our current funding opportunity, CIC-START Round 5. What we're going to do is talk a little bit about DASH and All In, and then we'll describe the CIC-START opportunity, and then we'll take your questions. Two important things. You can send us questions via the chat that is on the right, next slide, on the right side of your screen. And you can submit your questions there, or you can actually use the question box and submit questions there. Either way, we will answer them. Folks will be muted throughout the webinar because we have a bunch of folks on. Currently, there's 77 of you. We really appreciate your interest, and we're excited to engage with you today. We want to start with a quick little poll, and I thank you for everybody. If you go to the Mentimeter slide, I thank you for those who started to answer the poll questions. If you could quickly go to menti.com, if you haven't already, and use the code 360265. So I will wait for you to do that, and then I'm just going to run through the responses here. Swati, let's see, where's that? How many have we got? It's hidden right down, 40. So 40 of you, so about half of you have taken the poll already, and we have the experience. That's about all we can hope for. So why don't we go through the answers? This is good for us both to understand who's on the call today and also to understand the ongoing interest in the CIC-START opportunity. It's pretty amazing to me to think about the fact that this is our 5th round of these small technical assistance grants, and we're really pleased that so many of you are interested in them. So first up, it looks like the number one sector that's represented in on the call today is public health departments. This is pretty much how it usually goes. Public health departments and healthcare delivery. Very excited to see so many of you from community development and organizing. This is a sector that a lot of us are interested in because the potential expertise you bring around equity. And then also, wow, this is small on my screen. Social and human services and CBOs, if we put those together, as we often do, that's 10. So that's a nice set of group. For those of you who are looking and participating in the national conversation around the future of philanthropy, you'll know that there's a lot of folks, including us at DASH, who are interested in that nexus where public health, healthcare, and community-based organizations sit. So very happy to have all of you folks, and as well as folks from government and the something else. That's always exciting. You know, if you want to just say in the chat box what your something else is, we'd be happy to see that. So let's go to the next question. And wow, thanks. So many of you are answering the questions. Really appreciate that. This is always, we're always excited to see the big group of you who have never applied for DASH, and that's most of you on the call. One of the questions that we've already gotten, you know, if we've already applied for DASH funds and gotten them, are we still eligible? Yes, you are eligible. If we've applied and not been funded, are we eligible? Yes, you are eligible. And so, and yet, you know, like a lot of philanthropy, we're always interested in getting proposals where we haven't funded a community before, you know, because it's part of DASH's work to engage people across the country. That's great. Next up. I had a plan when I made this slide to have a little picture of what these actually represent. And so, because there's an official federal government representation of these regions, but you all figured it out anyway. So this is great. A nice set of distribution here. Especially interested in the fact that we haven't typically funded a lot in the Southeast, and is for Rocky Mountain, if we discount Colorado, and we don't discount Colorado, you're fabulous. But there's going there, but in the kind of the states around Colorado, when we look at a map of where we funded, that's a place where, together with the Plains, where we haven't had as much. So very glad to see this nice distribution here. This is really interesting. One of the things that we're going to talk about when we talk about the selection criteria is that DASH is, like a lot of you are, and a lot of people in the work in health improvement are trying to understand how to engage people with lived experience. So this is patients or service recipients or community residents, the folks who are actually most directly the target of our interventions. And so I think this is a really fair representation of where the nation is as a whole. And so we appreciate that, 9 of you have people with lived experience serving on your governance body, and some of you employ people with lived experience. Those of you who are brave enough to say you haven't consistently engaged people with lived experience, there's a lot of folks like that out there. And those of you who say, I don't know. And so I think that this is something where we are all trying to understand it, DASH itself, and our partners and colleagues and communities. And so this is it's an important data point for us. In the same way, we are, and Melissa, again, will talk about this when she talks about sort of what we're looking to fund in this next round of Kickstart. As DASH has grown, we've been around now for almost 5 years. We're consistently trying to understand how can we help and support and encourage and accelerate change in more places, because obviously with $15,000, $25,000 grants, we're not going to do it that way. And so we are interested in people who are trying to address policy development, who are trying to address system change, who are thinking even now about sustainability. Let me just say this now, and I'm sure Melissa will say it again later. We don't have any illusions about what can be done with $25,000 in 6 months. We recognize that we're not going to develop giant policies or really change systems there. And $25,000 doesn't represent sustainability for anyone. At the same time, we have to tackle these questions. We have to tackle it within DASH, but all of you in your communities have to tackle them eventually too. So we are interested in this. We're not going to pretend that you have to make unrealistic proposals, but we are very much interested in these elements. We did ask this question about alignment, which doesn't, oh, there we go. Okay. This is really primarily, and this is kind of, for those of you who are familiar with the term inside baseball, this is a conversation that we're having within Data Across Sectors for Health and our funders at the Robert Johnson Foundation, trying to understand, what does it mean, that tripod of healthcare, public health, and community-based social services. Addressing those folks working together is a part of what RWJF talked about when they talk about alignment. And so whenever we do a webinar, even one like this, we're asking what you all think. And it's not unusual to have collaboration, coordination, collaborative, together, working together, synergy, I like the ones that we haven't seen. I don't remember seeing focused or, agreement is actually really good. So thank you for answering that question for us, and we'll go to this. And so we'll come back to these questions for presenters. There's a shout out to Melissa. So we will address as many of these questions as we can. And so let's go to the slides. Again, thank you so much for participating in the survey. It's really helpful. All right. So again, for those of you who've joined us since we started, my name is Peter Eckert. I'm at the Illinois Public Health Institute, and together with our colleagues at the Michigan Public Health Institute, we represent the program office for data across sectors for health. We've been a Robert Wood Johnson funded program office for 4 years and 8 months. And so we've been doing this long enough to know that we've learned some things, and we've got a whole lot more to learn. When we talk about our work, we talk about multi-sector data. And that's why we opened with that question, because we want to reinforce the idea that, in the old days, folks mostly talked about healthcare, and they talked about doctors' offices and hospitals. And maybe some people talked about public health, maybe some people talked about behavioral health. But it was a fairly limited understanding of how health happens. And of course, as so many of you know, in your communities, the health is much bigger than that. It's very significantly socially determined. And so all of the sectors represented on this slide are a part of how we build and support and expand health, especially when part of our approach is to consider equity. So for us at DASH, we talk really simply about how we have 3 strategies that we're working on, and that all of our activities are intended to address. We are building the local capacity, and that's really what this project, this Kickstart opportunity is about. But then, we're walking along with our grantees and awardees to learn along with them, because what we want to do is build the evidence base. It doesn't make any sense for communities to start from scratch when some of this work has already been started someplace else. And so let's learn from each other. And it's the idea of doing things together that's really about the movement. I know I say this all the time, nobody's going to write a folk song about multi-sector community-based collaboration. But in fact, when we're talking about, hundreds of communities that have been funded by us and our colleagues, we really are building up a critical mass of people who are working in this space. And so those are the 3 things that DASH thinks about when we think about our work. All right, keep going. So today we're talking about Kickstart. It's one of 2 ongoing funding programs that we have. As I said, it's our 5th round of these grants. Our Kickstart round 4 grantees started in October. And then the other active program we have for funding is called the DASH Mentors Program. And in that program, we are highlighting 7 or 8 different mentorships. And within each of those mentors, we're going to select 5 or so communities. They're going to get $5,000 each to provide just basic staff support to recognize that they'll be working on a project with their mentors over the course of about 10 years. 10 months. 10 years would be a lot. We'll talk some more about this. Melissa will talk more about this when we talk about Kickstart. But because the mentorship application process is happening so quickly after we kick off the Kickstart, that you will have the opportunity after you submit your application for Kickstart, that if you want to also be considered or alternatively be considered for a mentorship, then you'll have that opportunity. So Melissa will talk a little bit more about that. I'm going to zoom through the rest of these, the slides on DASH. this is just to sort of to let you know that we've been doing this long enough that we have a sense for how this multi-sector community-based work happens. We are concerned with community health, well-being, and equity. We're concerned with a set of use cases. We use that language quite a bit right now because we believe that community collaborations that know what they want to do in a really specific way that reflects community needs and opportunities, those use cases are really what drives the work. It drives the planning, it drives the engagement in the community, it drives successful project management. So it's our sense that if you know what you want to do and how you want to get there, you're much more likely to succeed. I know, crazy, right? Next slide. DASH is one of the founding partners for All In, Data for Community Health. And we're kind of a big believer of the idea that the wisdom is in the room. And so for the last 3+ years, we've been building a bigger room together with our friends at Build Health Challenge, the Network for Public Health Law, New Jersey Health Initiatives, Public Health National Center for Innovation, and the Population Health Lab of PHI in California. Together, we represent over 150 community collaborations. And All In turns out to be a pretty great place to make connections with folks who have some kind of connection to what you're doing, be it geographic or your use case, or maybe the population that you're working on. And even when a project's sunset, when their funding ends or when they move on to other things, All In still maintains some of the knowledge and the artifacts of that work. And so that's why, even though we've already had a couple partners leave All In, from Academy Health and from the Colorado Health Foundation, we still have information available about what we learned there. And so All In is the home for this organizing. It's the home for the movement building that we're trying to do. Let's jump over that. We kind of covered that already. I think that this is a place where I turn it over to my colleague, Melissa Moorhead, who's been a part of DASH from the very beginning. She's at the Michigan Public Health Institute. She's our chief project management staff person and is leading the execution of the CIC-START process. So Melissa, please take it away.
Hi, Peter. Thank you very much. First, I'd like to check on my volume.
It's fabulous.
Excellent. I would also like to pause a moment and thank everyone who submitted some questions through the Mentimeter and confess to my colleagues in Illinois that had I paid more attention to that process, I'd probably be in a better shape to understand how to check in on those from time to time. So any help that you can give me when we get to the Q&A to make sure that we're addressing all of those questions as well, I would appreciate that. And
we're on it.
Thank you. And again, I also see questions coming in through the webinar, so that's great. I want to go through some slides. I'm going to be fairly slow and deliberate about reading some of them. Sorry for those that drives you crazy, but I do want to say that we are trying to make a fairly quick turnaround on this opportunity, and I know that it can be a lot to absorb going in. So I'm here to try to describe the CIC-START project itself and where it fits in our DASH work, where we hope it can fit into the work that you're doing in your community, and to provide as much encouragement as I can to say that we believe that you can get this application done and done well in the time provided. So CIC-START was born partially out of our love for clever acronyms. It does stand for Community Impact Contracts: strategic, timely, applicable, replicable, and targeted. And so those are important things to kind of keep in mind as being behind our thinking for the program as a whole. We, as Peter mentioned, know that it's a small amount of money in some cases, it's a short amount of time. And we really are thinking about it as not an opportunity to try to start something new. It's an opportunity to try to get something done within a larger collaborative context or within a larger project context that can take a number of different shapes that will be depending on where you are in your work. But it's available for people in every phase. However, successful applicants tend to have at least a fairly good multi-sector collaboration or a fairly established multi-sector collaboration that they can point to. It is one of our eligibility criteria, and be far enough along in their work that they have identified, or it's easy for you to identify the specific thing that an amount of money in a short amount of time could help accomplish. So, on the larger side of thinking about that, you might want to engage partners from new sectors. And you're working already on systematically sharing that data across sectors, or you're somewhere already in designing or implementing your initiatives or evaluating them, I would say. So sometimes you might be looking for adding a tweak or a use case to a multi-sector data system. You might be looking to how a new way to use data from your data sharing activities to support your collaboration's goals. You might be working on a new way to work on data governance amongst different participating data systems from different sectors in your collaboration. And again, one of the things we're particularly interested in is projects and communities that are ready to look at how to engage community members around data, or be attentive to the ways that in which data and data sharing projects can impact equity in communities. We're also looking for people who would like a little time and extra support to document or codify those processes that can help lead to the systems and policy changes that we're also looking for. And of course, there are several awardees who used this award to leverage additional funds or work with other funders on a specific purpose. So those are just some of the potential activities. I'd like to point out that the CIC-START brochure is available and has quite a few more potential activities in there, and a lot of well, maybe not a lot more, but hopefully restates all the things that Peter and I have been saying. And I really encourage people to read that fairly well, even if you have read it for a different round in the past. We agonize over tweaking sentences to try to make the meaning clear, and yet we know that we can, we'll always need to have an opportunity to clarify things. So do check over that and be thinking about where in your collaborative work is there an opportunity to move something forward if you just had that extra little bit of money or time. If you feel like you're not really there yet for this particular opportunity, again, we do see those mentorship opportunities as being available for people who are further upstream. And you don't necessarily have to decide. We might be reaching out to some of you with that opportunity as it develops. Next slide, please. So I mentioned the timeline a couple times. This is probably our shortest one ever because of the holiday in there, but applications are due on December 6th. That's the Friday, the week after Thanksgiving. And again, we do believe you can do this. Just we will be answering your questions in just a moment on this webinar. We do have an FAQ page that is available through the connect.org. And because we've identified some issues in how we've been collecting questions on our info@ email, we'll be giving you my email as well at the end of this webinar, so you can reach out directly with questions. And we'll try to stay really on top of that, at least up until December 4th. In order to get those questions answered for everyone. Again, just keeping in mind that the reason that we think that it is doable is that if you are ready for the opportunity, you'll find that it's a fairly short narrative application. We've kept the questions short and targeted. And we really just want you to be thinking about how to describe the one opportunity that this award would facilitate. We have the opportunity for you to submit more information about the larger project work through additional documentation. So in the example of, you have an existing data sharing project, and maybe you're trying to pilot a new way of linking records across systems from different sectors. You can submit your letters of support or other evidence from that larger collaborative project to help us understand where this particular proposal and your particular Kickstart award would go to make a difference. So next slide, please. We talk a lot about joining the All-In community, and one of the purposes of us for fielding this opportunity is to bring more people and more collaborations into All-In, so that peer-to-peer learning and connections can be made regardless of funding. So there is no cost to join. There's a little bit of time, and we did want to kind of make sure that you realize that it's an easy and quick thing to do to join. And we're actually working on enhancing that online community to make it easier for you to find other people and communities that might help you out along your path, whether or not you actually receive this award. Next slide, please. So we do have the eligibility criteria that we have been discussing. While we're looking for projects or proposals that have a strong use case and an articulated project plan. And I see that we've already had a question about demonstration of strong, active, and documented relationships. So whether you or not you have formal MOUs already, you might be able to point to some other awards that your collaboration has been receiving, or other ways to kind of describe those documented relationships, including in anything that you wanted to attach as a supplemental document. We are looking for people who are somewhere on the path to having that multi-sector shared data project. Of course, since it could be in the planning, implementation, scaling, or evaluation phase, we do try to hit it all. But there, again, this isn't an opportunity. It's too short and quick to really be trying to start a new data sharing project. We do use the term use case a lot. I've been getting some pushback on that jargon of late, but really we just mean that you've clearly articulated the problem or opportunity that is supported in your work plan and your budget that would show us exactly what you're trying to do with this award. We have, obviously we are a nonprofit funding other nonprofits, and we are limited to the United States. Next slide, please. Here we just repeated what you'll find in the brochure about being strategic, timely, actionable, replicable, and targeted. Again, those can have really large meanings in your collaborative and in the work that you are doing in your collaborative, which is great. And we do want to be able to have a sense of how that's going. But we don't necessarily expect you to say that we can take this $25,000 award and do all of those things equally well. It's fine to be focusing in on the one thing or the specific area that the award will help you move forward in. So next slide, please. Selection criteria really does boil down to how clearly the opportunity is represented, how well it's supported by the activities, and the value that the deliverable or deliverables, we only require one, will give to your multi-sector collaboration and your data sharing work. So we are always looking for a variety of sectors, as Peter mentioned. We do want to understand how you think the work that you're engaged in with data sharing is going to increase your community's capacity, and what benefits it will bring to the different stakeholders in the project as well as the community itself, and evidence that there's a multi-sector approach to that as well. We're all about the sharing, so we do ask you to discuss how you think that your lessons and experiences can be documented and shared within the All-In network. Next slide, please. And again, that thoughtful consideration of your proposed activities' impact on equity, both positive and negative. We'd like to see a consideration of how multi-sector data sharing and data sharing use cases have an impact on equity. So whether that's evaluating potential impacts, good or bad, and things you can do to mitigate that, or even starting out on a deliberate path to try to engage more with the community and understand their attitudes and beliefs toward or about data sharing and health equity are all very interesting to us right now. Again, we are moving to try to extrapolate from these small awards to figure out a path to broader policy or systems change. We'd love to hear from you about how your work might help us do that. Again, you don't have to make the case that this particular award is going to do that, but insight into why you think the work is getting us there will be very interesting. We do have some information about our current and past awardees online at dashconnect.org. So I noticed that there is a question out there about common characteristics of the different awardees, and I will admit that's something we wrestle with quite a bit. We have funded a wide variety of projects from different, led by different sectors, trying to accomplish different use cases, having different target populations in mind. We're definitely interested in geographic diversity, as well as other novel ways to bring in multi-sector data to community collaborations, and how that will help align localities in moving health equity and a culture of health forward. Next slide, please. So I alluded to earlier that the awards we know aren't the end all be all in themselves, but we have several things that go along with that we encourage people to apply, if only to be included in the All-In network. That's something that of ongoing support that we hope you'll be able to realize whether or not the funding is in place. And it's one of the things that we do expect of our awardees, though, again, it's sharing through All-In. We ask that you help us create your project profile and be willing to engage with others who might have questions about where you are. Other than that, we have a lot of projects going right now, so we are available for different kinds of check-in and technical assistance. We will expect to check in with you at least every 1 to 2 months to find out how it's going, and look for opportunities to help you connect with others or with technical assistance. Other than that, there's a final narrative report, which we are actually trying to streamline even more into more of a forms approach. And we'll do an exit interview with you as well to focus on what challenges you've encountered, what lessons learned, and any kind of products for dissemination or replication we could help you develop. And there's a number of other ways that we look to support our awardees over time, listed on that slide. Next slide, please. So a couple little inside remarks about the application process itself. The only way to apply for this opportunity, even though it is on the Robert Wood Johnson system, is to go to dashconnect.org Kickstart and look for the application link there. It has to do with our status as a program office. So you won't find it even if you have a profile on the Robert Wood Johnson Foundation system unless you go to that link first. Now, once done, all of the information that you already have in the Robert Wood Johnson Foundation system will be available to you. But we get a question quite often about, I can't find your opportunity. Well, they've made us a special link and it is available on our website. The application requirements are listed. There's 7 major sections. I highly recommend looking at the A&R system. That's what the Robert Wood Johnson Foundation system is called, early on to figure out how to add some collaborators, so it's not just all on you to be uploading things, or if anything should happen at the last moment that the person leading the application is not available to just hit submit there at the last moment. And make sure you have some collaborators who can help out. I would recommend looking at the project information questions, and those are the ones that are narrative and will need some, probably need the most thought in terms of how to efficiently communicate what you're trying to do with the support. There is a work plan template included in those support documents, so don't worry about trying to make one up from scratch. It's a very simple table where we ask what the deliverable or deliverables are, what activities are going to drive to those deliverables, and then a 6-month checkbox system out to the right for that. There again, that's required for the Kickstart, but we do again allow you to upload a different work plan that might answer more toward your larger collaborative work. And if you think it would be helpful for us to understand that in order to see how this request fits in, feel free to upload that as well. However, there is one required for a successful application for this particular award. Again, we have the budget worksheet, very basic. There is a budget narrative required as well. Remember, that's another opportunity to draw the connections between the work that we'll be funding and the outcomes that your collaboration is working toward, and how it will all fit in. So next slide, please. The Robert Wood Johnson Foundation offers 8 tips for a successful application. I think they're good ones and should be carefully noted since it's their system. They've been working on it for a while. One of the reasons that we do have that deadline earlier in the day on December 6th, 3:30 p.m. Eastern time, so I know it's even earlier for those of you in the far west. And hello, Hawaii, if you're on the phone. Very interested in having some applications from Hawaii. However, that is specifically because of the foundation being in the Eastern time zone, and if there are technical problems that we're going to need to start looking at those early on in the day. So at any point, if you have trouble with the online application system, email me as soon as possible. Almost always, if it's a technical question, you'll get a response back from someone at the Robert Wood Johnson Foundation. So we do take that seriously, and we know that there are things that happen outside of your control. Be sure to familiarize yourself with it in advance, and let us know right away if something's going on. You can start your application online and actually do it all online. You can have multiple people working on it, as I mentioned, by adding collaborators. And up until you hit submit, you can return to something and revise it at any time. That said, save early and often. My own experience with the system is I think it's a 2-hour timeout, but it goes by a lot faster than you think, and it's not necessarily reset if you've just changed fields within the system. So do save early and often. We also would love to see early applications. we won't necessarily be giving additional consideration to those, other than to the extent to which we also have a very short window to turn around our reviews and funding decisions. It will be nice to have some that we can, start reading right away. So the earlier the better as far as that goes. Next slide, please. Yeah, there again, please don't create duplicate applications. If you can't find one that you think you started, just let me know. We'll track it down for you. If you are only interested in looking at the application questions, we do have a PDF of the application available at connect.org/kickstart. It's under funding programs. So go ahead and download that if you like. And don't forget, at the last moment, you will have to press submit for every section in order for the application to show up as complete in the system and for us to know that it's ready. So don't hit submit until you are ready, but don't leave it necessarily till the very last second either, because it's kind of a drag if you, again, like I said, if someone who was supposed to do that has an emergency or something and just wasn't able to hit that submit. We wouldn't be able to review your application. So that said, I'd like to jump right into the Q&A. I noticed that we have some online that have been answered in text. So Peter, if I could ask you to take over, since I think you've been looking at those, and then you can call on me for anything that I might have seen.
Thanks, Melissa. That was great and really thorough. So what I want to do is actually wrap up this answer to L. Wolin Weber. Done. Okay, so let me go to the questions that we got from the Mentimeter first, and then I'll go back to the questions that are showing up on that those of you on the webinar have been asking. We've answered the first few of them, and I'll just say that all of the answers from today will also go on to the FAQ at the Kickstart page. Since this is the 5th round, some of these questions that you're asking we've answered at other times, but I'm happy to answer them right away. So first question. There's some confusion about whether a 501c3 private foundation can apply for funds. The Q&A says foundations are not eligible. A second question says a 501c3 may apply on behalf of a collaboration if we serve as fiscal agents. Please clarify. So I think we tried to answer this yesterday, but maybe it hasn't gotten out. So let me try to clarify. Private foundations are not eligible to apply because of the way foundations are addressed in the Internal Revenue Code, which is what 501c3 represents. So RWJF grants the money to us, and one of their requirements for us is that we can't give it to another foundation. So that's where the ineligibility happens. Now, the second question, it says that a 501c3 may apply on behalf of a collaboration if we serve as fiscal agents. And so what happens is the lead agency that would be the lead agency for the collaboration in the community may apply if they are eligible, if they meet the other eligibility criteria, and then name the 501c3 foundation as a fiscal agent, or they may name another organization as a fiscal agent. And so this is something that doesn't happen too often, but we have addressed it in the past. And so if this answer isn't still clear, please contact us directly. We can always make this work. We have funded somebody in our first round that didn't have any kind of fiscal agency at all. So the most important thing is to do the best job you can of representing your collaboration as use case. Are there larger funding opportunities for example, over $500,000 available from DASH or that DASH recommends, and are those related to this funding opportunity? I'm not aware of money like that. The original DASH grants were for $200,000 over 2 years. And so those kind of grants typically come from much bigger foundations than that I'm aware of. I mean, RWJF has other programs that may get into the six-figure range, but DASH doesn't make those. In terms of recommendations, my understanding is that, especially when those are related to community activities, that's about developing local relationships. So I'm sorry that I can't be more helpful there. I understand the appeal of that kind of money. I will say, I will use this as an opportunity to say that if you're not already subscribed to the All-In newsletter, we do try to push out relevant funding opportunities there. So if something like that came up, especially related to data, we'd probably be publicizing it in the newsletter, but we don't have any direct recommendations for that. So there's a question that just says eligibility, but I think Melissa did a good job of describing that. What are the more common characteristics of past awardees? I love that question because it gives me opportunity, to say if it would be helpful, it may be helpful to you to look at the projects that we've funded in the past under this award. I just made that recommendation to somebody in the chat. And so if you go to the CIC-START page at the Dash Connect site, you'll see a list of all of the awardees for the first 4 rounds of CIC-START. Not so much detail there, but there's also information at the Dash site and at the All-In site about more full descriptions of some of those awards. And so I will say, I would point you there. If I were just to speak to some of the common characteristics, I would say we recognize that our money, the funds in this program, $25,000 expected to be spent in 6 months. That's not enough to start anything, which is why we don't fund communities where they don't already have strong collaborations already. It's not that we don't understand the value there, is that we just don't see that we can, that communities that aren't already organized together can get anything done in 6 months. It's just too hard to do this complex multi-sector work. So, so communities that can demonstrate that they've been working together and that our support would enable them to realize an immediate opportunity or address an immediate problem. Those things are compelling for us. I mentioned in my introduction how important having a good use case is. It's again, because this work is complex and difficult, you know, you have to kind of know what you want to do. And I'm sorry to say something that's so obviously true, but a lot of us are involved in things where folks are trying to figure stuff out, but they haven't really yet. And unfortunately, we're not able to support proposals where folks don't already have a good idea. You know, because when you're talking about multi-sector work, that means you have to have a bunch of people in the community that have said, we have these values in common that we need to organize ourselves around. And we think that data is or will be a big part of how we address this particular opportunity or need. And so those two things we think are really important. Let me go on to the next question. We work in a very rural area and frequently share projects with other communities partners. We often do not have formal written agreements for shared projects. What documentation of a shared project is required? As Melissa said, there's an opportunity in the application to describe previous collaborative work that you've done. You don't have to give, evidence of, formal evidence of like a letter of agreement between folks. You can describe the work, who was involved with it, what you did together, how it endures. Those kind of things are important. If you do have any kind of evidence or documentation of the previous work that you've done together, newspaper article, internal reports, evaluations, all those things are valuable. But it's really, can you tell us the story about what happened? Do you expect at the end of the project for the partner organizations to have both designed and implemented a shared operational database? Not really, but we also recognize that some collaborations are at a place where they've been working towards something, and our support would get them to, that last mile, so to speak, where at the end of the project, they might in fact have some kind of shared operational database, or they've added, another sector to an existing database, or they've added new capabilities to an existing database, or they've taken something from a plan and they've started the design and testing. We recognize, and if you remember the slide where I showed the framework for our work, we recognize that this stuff happens in stages. And so you may be proposing to take something from one stage and move it to the next stage. I'll jump ahead to the last question that we got from the Mentimeter. If we are in the planning stages, is this grant appropriate? So this is a tough one for us, because on the one hand, every great thing that was created has to be planned first. So we recognize that a planning process is in fact a necessary prerequisite for a shared data system to be developed and used. At the same time, a lot of people sort of say, if we only had money to do planning, that's what we need. And that may be the case for some collaborative enterprises, but it may be that they're just not ready because they don't have the right kind of relationships, or they don't have a true understanding of what needs to be accomplished in the community, or they haven't fully engaged people with lived experiences. There's a lot of reasons why people are not yet ready to implement. So this is to give cautious encouragement to those of you who are in a planning phase. But what we'll be looking for is evidence that that planning phase represents, a lot of real agreement and a shared commitment from the partners about how you're going to move forward. This question, we're working with a university, a health system, folks in various sectors, and an external national organization. See how I'm de-identifying everybody? On a comprehensive look at mental health and its root causes. We want to develop a new platform. Can funds be used for a consultant? Yeah, this is a great question. Yes, we absolutely see that that it's appropriate to use CIC-START funds for engaging a consultant. Honestly, $25,000 over 6 months isn't typically a great use for that. Is not sort of existing staff, right? You can't, CIC-START funding just isn't enough to really fund, adding new staff. And so engaging outside consultants is actually a really good use for CIC-START funds. I also want to emphasize that when we think about how we're making a decision about who to fund, we want to understand what is going to be the impact of the CIC-START funds in community collaborative work. And so we want to understand how engaging a consultant will build the community capacity to do multi-sector community-based data sharing or collaborative work around data. And so, just taking 25 grand, moving it to a consultant and having them build something for you, you'd really have to articulate how that builds the capacity. And so that's kind of the balance, is that not a balance, that's the challenge. How will you use DASH funds to demonstrate an appreciable impact on community capacity. And I know some of you may be sort of saying, well, you can't do anything with 25 grand. So I don't want to say that a $25,000 is going to completely move the needle. But we have enough evidence from past Kickstart grantees that folks can actually do quite a bit when they have when they have good, solid relationships and they knew what they want to do. All right, we are at 4 minutes to the top of the hour. I am happy to stay on the line and answer any questions that continue to come up. I'm going to move to the questions that have been asked during the webinar. And so let me get to those right
Peter,
now.
Can I suggest one?
Yeah, please do.
Because it's apparently from someone who has made an application before, and I think we can answer them by saying some of the reasons or some of the places where applications fall short. And I was just thinking in my answer to this question is that applications that don't clearly describe the opportunity or use case, they don't clearly describe the multiple sectors engaged in the work, not just different organizations, or clearly make the case that they can accomplish work by having a clear work plan and budget that is all tied together, I think are what makes applications less attractive. However, within every application opportunity, we do weight things based on geographic provenance, the types of use cases, the types of sectors involved, and we don't know what that's going to look like until we get those applications in. So unfortunately, some of that, if you had a competitive application, it may have been a very competitive application that would be competitive still. But do keep in mind that we definitely look for the evidence of engagement from different sectors, not just organizations, and in a nicely described opportunity or use case that is well supported by the work plan.
Thanks, Melissa. I think that's really helpful on behalf of people who are listening. I also, and I guess I'm willing to say this because I know that there's very few people on the webinar who have previously applied. You know, for those of you who've done the hard work of applying in the past and haven't been funded, you know, I'd be happy to have a short conversation that kind of addresses this. We certainly don't want you to go to the work and submit again if there's an issue that we would want to raise. So I'm happy to make that offer for those of you who are in that particular point. There's one other question that we haven't answered in the chat. Would this grant be considered a subcontract since funding came from RWGF to DASH, or is it considered a grant from DASH? So this is a DASH grant. RWGF has two kinds of ways that they manage funding. They make direct grants themselves, and for sufficiently mature programs, those are allowed to do their own grant making. So even though we use the RWJF A&R system to manage the application and review process, the grants will come directly from DASH. And in fact, since the Illinois Public Health Institute is the fiscal partner, the grants will, the checks will come from the Illinois Public Health Institute. I think we've answered all of the questions. I want to look at and I don't see anything in the chat, and I think we've answered all the questions that came into the questions. So I guess I want to congratulate you and us on making perfect use of our time. I want to thank you for the time that you've spent on this webinar. Thank you for your interest in Data Cross Sectors for Health and the Kickstart opportunity. I want to wish you good luck, and if you have questions, you can continue to send them to us. We will respond to you directly, but all of the answers will also go in the FAQ so that if other folks have a similar question, they'll have access to it. Melissa, am I forgetting anything?
I don't think so, thanks. We had a late breaking questions about how many applications do we usually receive, and there again, it's been a variety. We received 56 applications for round 3, so it's not a huge pool. I would just like to not let that be a barrier.
Yeah, it's not so many that we can't really sort of thoughtfully consider everybody's application. So again, this is the 5th round. So you have information from the FAQ to answer some of your questions, and you have the listing of past applicants. And so please consider taking a look at that to help guide you as you move forward. Again, thanks very much and good luck.